Physio should focus on the functional therapy over temporary symptomatic relief for most patients. This is the Pareto principle, the 80-20 principle. 80% of our outcomes come from 20% of our efforts. Some other examples of this 80-20 rule in physiotherapy include a small number of exercises account for most recovery. See my exercise book for examples. A small number of physios account for all physio content on YouTube. A small number of physios run most of the clinics versus the majority of physios are employees. A small number of physios are politically motivated. This small number of physios dominate the various professional associations that we have. By contrast, the majority of physios want to work without political affiliations. We all know that different workplaces see different patient populations. My experience shows me that these various physio patient populations follow this 80-20 rule. This 80-20 split comes from physio being a subordinate branch of medicine. Our roots in medicine give us this 80% majority of our patients. The 20% of physios come from what I'm calling the outpatient consumer marketplace of non-traumatic care. Yeah, I know it's a mouthful. This is the consequences of the foundational elements of Western civilization. Niall Ferguson calls them the 6 killer apps of prosperity. This outpatient consumer marketplace of non-traumatic care comes out of the competition in Western society and the consumerism of Western society. This 80-20 view of physio is also an example of systems thinking, which also comes out of information theory. There is the 80% majority and the 20% minority. Like I said, you will see this through the lens of where you work. But looking at the big picture, this is what I see. Yes, these are generalizations, and every patient you see will probably be in this column or that column. First, the majority, 80%, low-hanging fruit. Macro therapy, practical therapy, whatever you want to call it. I expect a high physio success rate with these patients. This is based on widespread basic physio skills. There's measurable loss of motion and strength with these patients. Expect measurable progress in 4 to 6 weeks with pretty much any physio. This is a simple diagnosis. This is a simple treatment. These patients need a functional active exercise approach. Physios share evidence-based tested protocols. This is like the ACL protocol or a post-rotator cuff protocol. These are inpatients. This is rehab patients. This is nursing home physio. This is the outpatient care for post-op and fracture and trauma care. The second column we have is the minority, the 20% I'm calling chasing butterflies. This is also called microtherapy or subjective therapy. The physio success rate with these patients is unclear. The physio for these patients is usually based on specialized knowledge and rapport with the patients. When we see them in examination, the range of motion and strength are usually within normal limits, but they have pain and subjective loss. The progress with these patients is unclear. Sometimes you have more than 6 weeks of therapy with multiple professionals with unclear progress. The diagnosis is complicated. The treatment is complicated. This is a mixed bag of guessing or some miracle cure that makes the patient better for no apparent reason. There's a lot of modality use. There's a lot of manual therapy use in these patients. These are proprietary systems based on clinical observations and experience. This is McKenzie, Mulligan, Maitland, Syriacs. This is muscle energy. This is craniosacral. This is the use of KT taping. This is dynamic neuromuscular stabilization. This is what I'm calling the outpatient consumer marketplace of non-traumatic care. I'll give some examples. Some problems are obvious, objective, and indisputable. For example, loss of motion after immobilization of a fracture. This is common. Patients tend to do well. They recover their motion, they get their strength back, they do their home exercises. Another example is lateral elbow pain with grip squeezing. This is common. This is characteristic of tennis elbow. We can measure the grip strength loss. We can reproduce the pain with effort. These are typically overuse type injuries. Recovery is dependent on activity modification. By contrast, some problems are subtle and subjective and controversial. For example, non-traumatic low back pain with full active range of motion and full strength. Most of this gets better no matter what you do. So don't make things worse. Use pain-free exercises. Another example is intermittent shoulder pain with effort. Full active range of motion, nearly full strength, no better with prior physio exercises. The treatment here is, again, don't make things worse. Give pain-free exercises. There are implications from my 80-20 physio patient thinking. Remember my title, Physio should focus on restoring function rather than symptom relief. Most therapy works because it's in the 80% low-hanging fruit column. Functional active exercises work. This is movement retraining. This is patient education. This highlights the importance of evidence-based active interventions in physiotherapy. This is how we should allocate resources and funding in physiotherapy. The question comes, what do we do about the 20%, what I'm calling chasing butterflies? Well, we do nothing. There's no way physios everywhere are going to give up on this part of healthcare. These patients still need care. But this is the brand confusion of physiotherapy. Physios will have to continue to compete in the consumer marketplace of ideas. Lots of physios will say, I do this or I do that, and this really helps my patients. But usually just being positive and supportive works just as well. I've seen lots of physios do lots of different treatments for lots of different reasons, and most patients get better. So I'm skeptical of any particular effectiveness with some different schools of physio thought. My goal here is to make physios aware of this dichotomy of patients. We need to realize we do so much good work, and yet there's also a lot of baloney out there. This is the push for evidence-based practice. There are two common physio treatments that I'm not a fan of, which are passive modalities and manual therapy. Active exercises is almost always a better treatment option. That was the title of this video. Physios should focus on restoring function rather than symptom relief. What do you think? I hope my words haven't ruffled your feather. I'm just trying to share some interesting ideas without having anyone blow a gasket on me. Let me know in the comments below what you think. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Discover another video here or subscribe to stay connected. Thank you.